HIV/AIDS. HIV/AIDS human immunodeficiency virus, HIV/AIDS, how many get it? What is it? Human immunodeficiency virus, HIV/AIDS. How many get it? 40,000 people in US are infected each year. Over 1 million people in the US are living with HIV. Symptoms: can take up to 10 years or longer to have symptoms. Unexplained weight loss. Flu-like symptoms. Diarrhea. Fatigue. Headaches. Severe or recurring yeast infections. How is it spread? Unprotected oral, anal, and vaginal sex. Sharing contaminated needles. Mother to baby. Treatment: no cure. Medicine can slow down process. Early treatment makes a big difference. Consequences: increased risk for infection of other STDs. HIV is deadliest STDs. Become more vulnerable to certain cancers, infections, and pneumonia. What is AIDS/HIV? HIV human immunodeficiency virus. A virus that attacks the immune system. AIDS, acquired immune deficiency syndrome. A disease in which the immune system of the patient is weakened. The origin of AIDS. In 1999 researchers discover origin in subspecies of chimpanzees. Native to West Equatorial Africa. Thought to be spread to humans through the hunting of the chimpanzee and transmitted through infected blood. Coming to America. The earliest presence of AIDS in American is thought to be in the 1970s. Doctor reports from Los Angeles and New York show a rare deadly form of cancer rising in males that were involved with other males. In 1982, doctors labeled this new disease AIDS. During the 80s as many as 150,000 people a year were becoming infected. This number dropped to about 40,000 per year in the 90s. Why teens are at risk? The number of AIDS cases is decreasing, but the number of HIV infections is not declining from those ranging 13–24 years of age. The reason for this is new treatments and drug therapies that are allowing patients to live longer. How HIV attacks body attaches to the surface of the cell. Core of the virus enters cell and goes to nucleus. Virus makes copy of genetic material. New virus assembles at surface of cell. New virus breaks away from cell, destroying it. What this does to the body. HIV virus enters certain cells of the immune system. T cells help lymphocytes identify and destroy invading pathogens. Once the virus takes over and copies itself, it destroys the cell when it breaks out. This process repeats itself continuously, destroying the number of T cells that help fight off invading pathogens. AIDS versus HIV. As the virus begins to duplicate, the number of T cells begins to decrease and the body is weakened to fight infection. The body is susceptible to opportunistic infections. Infections that occur in individuals who do not have healthy immune systems and are difficult to treat. This process takes place over months and years. The virus does not become AIDS until the number of T cells drops below a certain number. How it is transmitted. Sexual intercourse, secretions from the infected partner enter through any cuts or sores that may be caused from standards, or the transmission of fluid. Sharing needles, any injection of drugs that punctures the skin if infected can be transmitted from person to person. Mother to baby, through the umbilical cord and during delivery, also through the mother's breast milk. With the use of antiviral drugs, mothers can drop the risk of transmission down to 1 to 2%, becoming infected. Just like many STDs, Many people infected with HIV show no symptoms and do not receive treatment for several years. Although a person is infectious immediately, symptoms may not show for 6 months to 10 years. Half of people infected develop symptoms in first 3 to 6 weeks. Symptoms that do appear in first couple weeks include fever, rash, headache, body aches, and swollen glands. These symptoms disappear within 1 week to a month and are often mistaken for a viral infection. Once symptoms disappear, the infected person enters the asymptomatic stage. Stages of the infection: asymptomatic. Asymptomatic stage: a period of time during which infected person has no symptoms. This also includes those that show symptoms in the first few weeks. During this time the virus continues to grow inside the body. At this time the immune system will keep pace with the infection, generating billions of new cells until the HIV takes over and infects and destroys most of the cells in the immune system. Stages of infection: symptomatic. Symptomatic stage: the infected person with HIV has symptoms of infections due to the severe drop in immune cells, helper T cells. These symptoms include swollen glands, weight loss, and yeast infections. Stages of infection: AIDS. Presence of HIV infection. Severely damaged immune system, measured by number of helper T cells. Appearance of one or more opportunistic infections. By this time HIV has reached the brain cells, causing difficulty remembering and thinking. Detecting the infection. A testing: if person thinks they are exposed, they will get tested. A test responds to antibodies in the blood. The initial test can cause inaccurate results. Retesting: if the A test is positive, they will retest using the same A test to rule out any inaccuracies. Western blot test: if the repeated test is positive, a Western blot test is performed. The most common test for HIV in the United States. If done properly, test is 100% accurate. If positive, individual is referred to as HIV positive. Inaccuracy of a false negative. Test shows the infected individual test negative for infection when the person is HIV positive. Most people take 3 to 4 weeks and up to 6 months for antibodies to be present in the immune system. If tested before antibodies are present, the test will show a negative result. Inaccuracy of a false positive. Test shows individual is positive for HIV, but the individual did not contract the infection. Certain health conditions will cause the test to show a positive result for HIV antibodies when there are none present. These conditions are hemophilia, hepatitis, and pregnancy. Treating the infection. There is no cure for HIV/AIDS. There are drug cocktails, combination of drugs available to slow progression. Some treatments had severe side effects, causing people to stop treatment. Stopping treatment allows virus to mutate and new drug-resistant strains of the virus are developing. Health services currently available. There are currently drugs that can help treat HIV and prevent the complications of opportunistic infections. These drug treatments will only improve the quality of life, they do not cure disease. Treatment can be costly, exceeding $1,000 per month. Also, some countries do not have all of the treatments available. The continuing problem. The new reports of AIDS cases are decreasing. This is in part to the drug cocktails slowing down the progression of HIV to AIDS. In the year 2002, nearly 5 million people had become infected. At the end of 2002, an estimated 40 million people had been carrying the virus.